Varanasi, and I'm a doctoral student at Frontier Nursing University. I'm presenting a public service announcement about cultural humility. First of all, I will start with an introduction, a background, application of cultural humility to organizational leadership and clinical leadership, and then I'll talk about famous leaders who exemplify this cultural humility, and then I'll end with a reference page. Alrighty. I feel like in order for me to really go through this seamlessly, I feel like I have to show you a PowerPoint so that you can actually get to see my presentation. All right. Okay, I'm gonna start with the very first slide, which is the introduction description. Okay, so what is cultural humility, right? Cultural humility, as you can see here, is basically having a sense that one's own knowledge is limited as to what truly is another's culture. Okay, so this model wants you to be other oriented rather than self-focused. It wants you to have respect for others and have lack of superiority, and they want you to entertain hypotheses rather than drawing to conclusion. Okay. Alrighty, so this is a PSA, and it's targeted towards nurse practitioners, as we are leaders in healthcare and we'll come across people from diverse backgrounds. Okay. So cultural humility is a process of self-reflection and attitudes towards individuals of other cultures. It pushes us to challenge our own cultural biases and approach learning about other cultures as a lifelong goal and process. Okay, emphasis on process. Why is this important? It is important because our country, the United States of America, is a racially and ethnically diverse nation, and practicing cultural humility is valuable, especially in healthcare. As nurse practitioners, being culturally humble will help foster trusting relationships with our patients. Also, it will make them feel safe to come to us for their healthcare needs. I'm going to move along to slide 2, which talks about background. Okay. Um, from this image, you can see that cultural humility is a 24/7 process. So it's never ending, it's a continuum. Okay. So let's talk about cultural competency versus cultural humility. So I didn't really throw in cultural awareness is knowing thyself, your own cultural biases. But then cultural competency is, reading up on another's culture, knowing the information about it. However, cultural humility is to be able to actually be humble to ask the patient or an individual about their own lived experiences. Okay. According to Tavalan and Murray Garcia, 1998, cultural humility was established due to limitations of cultural competence. So just because we are competent about different cultures does not mean that it can be generalized to an entire population. Cultural humility, on the other hand, encourages an active participation in order to learn about a person's cultural and personal experiences. Cultural humility in its name implies that one has to be humble to others' culture and experiences. To practice cultural humility is to be willing to relinquish what you think you know about an individual based on generalizations about the culture. Instead, have a deeper understanding of someone's culture, which stems from being open to what the person tells you about their personal experiences and cultural heritage. Okay? So, Tavalan and Murray Garcia said that there are 3 factors, and these 3 factors can be used by nurse practitioners to guide them towards cultural humilities. Number 1 is having a lifelong commitment to self-evaluation and self-critique. This means that the cultural humility is a never-ending process, and we have to be able to be flexible and humble when interacting with our patients. Okay. Number 2, being able to fix power imbalances. So as nurse practitioners, we have a lot of power. Okay, so remember that you hold the power in scientific knowledge, while the patient holds the power to his or her personal history and preferences. So we have to make sure that you do not tip this balance when taking care of patients. So number three is developing partnership with people and groups who advocate for other cultures. Okay, so as nurse practitioners, we can advocate for our patients, our families, and communities in a systematic way. Okay, we can do it big. This may involve getting your organization involved in improving patient care and experience. Okay, so I'm going to move along to slide 3. Okay, so slide 3 talks about applying cultural humility to organizational leadership. So what can nurse practitioners do? Nurse practitioners can help their organization integrate cultural humility in their mission and vision. This is because, according to the symbol frame by Bowman and Deal, 1997, symbols carry a powerful intellectual and emotional messages. Another point, the human resource framework supports that leaders like the CEO can model cultural humility, and nurse practitioners can help the CEOs, help the people at the top to model cultural humility. We as nurse practitioners can do the same too, especially, to our MAs and, our other helpers. Let's see. Nurse practitioners can also assist their organization to practice diversity and inclusion. Okay, so this is how we can apply this to organizational leadership. So moving on to applying cultural humility to clinical leadership. So I like this picture right here, and it talks about cultural humility, how you say things matter. Okay, so let me read this. It says, "You're Japanese, question mark. You must love sushi." So a better way of saying this could be, "You're Japanese. How do you feel about sushi?" So this opens up a conversation, but it's assuming that somebody from Japanese background loves sushi. Okay. Okay. So example of how nurse practitioners can deal with cultural humility in healthcare. Instead of assuming your Mexican patient must be Catholic because of what you learned in nursing school, it will be best to sit down and talk with the patient to identify his or her lived experience and personal beliefs about his or her culture. Okay? You can be culturally competent, but without cultural humility, you can run into trouble of assuming the wrong thing about a person's culture and ultimately pissing them off and losing them as a patient. Okay? As nurse practitioners, we have an obligation to advocate and empower patients and families during the most vulnerable times of their lives. In order to do this effectively, we ought to be willing to sit down and listen to them. Also, we need to be aware of our own implicit biases and leave it behind before interacting with patients. All right, so I'm going to talk about famous leaders who embody cultural humility. So the first person that comes out of my head is Mother Teresa. Okay, so Mother Teresa, when she was a teenager, she moved to India, and in India, that's where she was able to do all the things she's done. Okay, so I feel like for her to move to a different culture, a different place, and be able to help these people, she must have had to sit down and, be able to assimilate with them versus, thinking she's culturally competent. She must have been able to be culturally humble in order to be able to take care of these people and, winning their trust. So I'm going to go over Mother Teresa's humility list. Okay, so number 1, speak as little as possible about yourself. Okay. Number 2, keep busy with your own affairs, not those of others. 3, avoid curiosity. Number 4, do not interfere in the affairs of others. Number 5, accept small irritations with good humor. Number 6, do not dwell on the faults of others. 7, accept censures even if unmerited. 8, give in to the will of others. 9. Accept insults and injuries. 10. Accept contempt, being forgotten and disregarded. 11. Be courteous and delicate even when provoked. 12. Do not seek to be admired or loved. Wow. So 13. Do not protect yourself behind your own dignity. That's a good one. 14. Give in discussions even when you are right. That's a very good one about cultural humility. And then lastly, 15. Choose always the more difficult task. All right. So I'm going to move on to the next slide, which is Martin Luther King Jr. I feel like he also embodies cultural humility in a big way. So I'm going to go over his quote. He says, life's most persistent and urgent question is, what are you doing for others? So this talks about servant leadership and also talks about cultural humility, because without being, humble to other people's culture, then you won't really be able to serve them. You might be doing a disservice if you can't culturally humble yourself to others. Okay. So I'm going to move over to my references. If you have any questions, comments, leave it below and I'll answer that later. Thank you all so much for listening. I chose cultural humility because it just assimilated so much to me. I connected more to it than any other and any other style I saw, and I knew I would do a good job with it. I'm from a different culture, so I understand what it is when people can't be culturally humble. So that's why I chose this topic. Okay, like I said, you can leave the comments below, and I'll answer them later. Thank you so much. Appreciate it.